name is Emmy. I'm going to be your nurse today. I'm going to do a full head-to-toe assessment on you. I've already confirmed his name and date of birth for his privacy and safety. I'm going to shut the curtain for privacy as well as use hand sanitizer for his safety and my own. Okay, I'm going to start with your head. Just going to look at it, look for any bumps, lumps, lesions, anything I should note. I'm then going to palpate around your scalp. Any pain or discomfort?
No.
And palpate through his hair. If there's anything I can't see but can feel. Palpate senses. Any pain or discomfort?
No.
Okay. And finally, lymph nodes. Any pain or discomfort?
No.
Okay. I'm going to assess his mucous membrane. I'm going to start with his eyes, checking to see if they're equal, round, reactive to light. Great. Great. Look in his ears. Both ears are good. Open your mouth. Say ah. Throat looks good. Voice and intact. Stick your tongue out for me. Up. Down. Your tongue, not your head. Yep. And then side to side. Great. And then close your mouth. Can you move your head up and down for me? Any rigidity there with your neck?
No.
Good. I'm now going to assess the rest of the skin on his body, starting with his arms. Looks good. No pain, discomfort in your this arm?
No.
His fingernails are appropriate in color. Good capillary refill on his right hand. Less than 2 seconds. No clubbing, no cyanosis on his extremities. No good capillary refill on his left hand. Going to assess his legs. Any pain, discomfort in your legs? And assess perfusion on his toes using capillary refill. Good on both sides. Great. I'm now going to move on and assess your respiratory system. I'm going to start just by looking, so if you could sit up straight and take a deep breath for me. All right, both sides are symmetric from the front. Another deep breath for me. Both sides are symmetric from the back. I'm going to just start by assessing for fremitus, so I'm going to place both hands on your back and I'm going to have you say 99 as I move them down. Okay? Ready?
99, 99, 99, 99, 99.
Great. I'm going to do the same for the front.
99, 99, 99, 99.
Great. I'm going to now listen. I'm going to listen first in all the spots I have to listen to, and then we're going to go back and we're going to listen to all the same spots and then have you repeat 99 again, okay?
Okay.
So first time, just take deep breaths when I move the stethoscope. All right. Ready? Deep breath. Deep breath. Another. Great. All right, great. I'm going to go to all those same spots and have you say 99, okay?
Okay. 99, 99.
Great.
99, 99, 99, 99, 99, 99,
All right, and then the front as well.
99, 99, 99, 99, 99, 99, 99, 99.
While I'm back here, I'm going to assess your costovertebral angle tenderness, assess for any kidney discomfort. Just going to percuss a few spots in the back. Let me know if you're feeling any discomfort. How's that?
No discomfort.
Great. All right. Now I'm going to assess your peripheral vascular system. I'm going to start by listening to your heart. I'm going to listen to your carotid, and then I'm going to palpate the rest of your pulses, okay?
Okay.
So if you sit up straight for me. Just breathe regular. I have this on, I'm gonna listen to your carotid using the bell of my diaphragm, the bell of my stethoscope. Great. Great. Blood flow sounds regular. Alright, I'm gonna start by palpating your temporal artery. Good. Up straight. Carotid, one at a time. Great. Brachial. Good. Good. Radial. And each side. Good. Nice and strong. Your popliteal. I would normally do the femoral, but popliteal, we'll move right to the popliteal for privacy reasons. Good. Great. Now I do the anterior tibitalis and the dorsal pedis on both sides. Both are good. Pulses are strong and equal throughout. Great. Now I'm going to have you lay back so we can assess your abdomen. Normally I'd assess abdomen without a shirt on, but for privacy and safety reasons we'll leave the shirt on. I would assess for any bulging, any lumps, bumps, lesions, bruises, anything that could be of concern that we would need to note it as an abnormal finding. I'm just going to start by listening to all 4 quadrants as well as listening to the ascending abdominal aorta. Alright, I'm just going to listen until I hear bowel sounds in all 4 quadrants. Great. Great. Good. Great. The abdominal aorta sounds appropriate as well. Alright, now I'm going to do a combination of palpation and percussion to assess the rest of the abdomen. I'm going to use deep and soft palpation. Any tenderness, discomfort?
No.
Assess the spleen. Feel for the liver. Great. Going to do a combination percussion. Assess for different sounds over different organs. Any pain or discomfort with that?
No.
Okay. While I have you lying down, I'm just going to assess your hip range of motion, okay? So could you lift this leg up for me? Great. Put it down. Lift this leg up for me. Great. Put it down. Bring your knee to your chest. Good. Back out. Knee to your chest. Great. Back out. And then I'll have you push against resistance, pull up against resistance. Good. This one. And then lift this leg up and hold it there for 5 seconds. 1, 2, 3, 4, 5. Great. This one, same thing. 1, 2, 3, 4, 5. Great. So if you could sit back up for me. All right, I'm going to assess range of motion in the rest of his musculoskeletal system. We're going to start with your head. So if you could put your chin to your chest and back up, side to side. Great. Now I'm going to have you do that against some resistance. So push against my hand. Good. Push against my hand. Great. Now we're going to move to your shoulders. Sit up straight and shrug them for me. Up, down, up, down. Good job. And now against resistance. Great. Okay. Now if you could put your arms at your side and then lift them up for me. Great. And back down. And then forward for me. Great. And back down. And then if you hold them out straight and push against resistance. Great. And push up against resistance. Great. And now we're going to assess your wrist movement. So if you could point down, flex up, and now side to side. Okay, and now hold them out straight, push down. Great, push up. Great. We're now going to move to your legs. So if you could straighten out this leg for me. Great, down, straighten out this leg for me. Great, down. I'll have you do that against the resistance. Good, against resistance. Great. I'm going to go down to your feet and assess your ankles. If you could hold it out for me and point your toe, flex, and point. This foot, yep, and back. Great, and then again, push against, yep, and then pull. Great. This one, push, pull. Great. And now we're going to assess some neuro. Could you tell me what month it is?
February.
And what day of the week is it?
Saturday.
Great. What year is it?
2022.
And who's the president?
Joe Biden.
Good. I'm now going to hold your hands out in front of you. I'm now going to write a letter in each of your palms. I'm going to have you close your eyes and write a letter in each of your palms, and you're going to tell me what the letter is.
B.
And this side?
A.
Okay, great. With your eyes closed, I'm going to place something in your hand, and you're going to tell me what it is.
Okay. Is it a pen?
Great. And then this one?
Is it still a pen?
Yes. Alright, and if you could hold your arms out to your side like an airplane, and close your eyes. Is that out to your side like an airplane? And then touch your nose. Yep. And then the other one. Great. And then finally, could you can put your arms down. Can you count backwards from 100 by threes?
97, 94, 91, 88, 85, 82, 79, 76, 73.
Great. That's awesome. So just finally, I want to assess your gait. So if you could stand up for me, put your hands at your side, and just stand up straight. And now do that with your eyes closed. Assess for any balance issues. There's no wobbling. Great. You can open your eyes. I'm just going to assess your spine while you're standing up. I'm just going to palpate down it. Let me know if there's any discomfort. Great. And if you could hinge at your waist. Awesome. And back up. Great. And now walk forward. And now turn around and walk back. Alright, now do that on your tiptoes. And come back heel to toe. Great. Alrighty. You did a lovely job. Thank you so much for letting me assess you. Your head to toe assessment was normal and within all normal limits. So thank you so much.